Now, we at Care Not Killing have a lot of concerns about this. We have seen with the COVID pandemic how elderly people, disabled people have suffered more than others, how they haven't received the same care as other people have received in many cases, how there has been a disproportionate number of disabled people have died as a result of COVID, how do not attempt resuscitate office orders were placed on people without their consent or their knowledge. The government have been very clear that the policy on do not resuscitate orders wasn't that it should be applied in a blanket way. It's almost certainly a breach of human rights, and yet it happened. So, how can we trust the safeguards which are being talked about for this bill that the government would actually implement them? And moreover, in other jurisdictions, we've seen how the safeguards are eroded. So, in the Netherlands, assisted suicide and euthanasia were introduced. They were expanded from people who are terminally ill to people who are chronically ill, from people who are mentally competent to people who are not mentally competent and have psychiatric illnesses, from adults to children. And there's a debate currently in the Netherlands about applying them to children aged 1 to 12. It already applies to infants who are disabled with spina bifida and other conditions up to the age of 12 months. In Belgium, we see that the laws are not implemented properly, that euthanasia deaths happen outside of the law without consent having been obtained. In many cases, they happen for people with a multitude of minor conditions, even where they don't have any major terminal illness or major suffering, which would qualify under the law. So there are all sorts of abuses happening in the Netherlands and Belgium. Even in Oregon, we see that where the numbers have increased from 1998, from 16 to 245 in 2020 of those who are having an assisted suicide. It's likely that 25% of those people at least are clinically depressed, and yet only one or two per year have been referred for psychiatric evaluation. So there's a huge number of people, probably up to 60 in 2020, who should have been referred for psychiatric evaluation before they were given an assisted suicide, but who weren't. This is what happens in places like Oregon. They claim that they have strict safeguards, but those safeguards are not implemented. And then in other places such as Belgium or in Canada, we're seeing hospice funding being threatened. And in Canada, the government published data recently saying that they had saved $140 million on care services as a result of introducing euthanasia. These are the dangers, I think, that whilst it's introduced on the basis of autonomy and rights, actually it ultimately gets driven by other factors, saving money, people who are vulnerable being deemed by other people that their lives are not worth living. And this is a very dangerous development, and we really need to not go down this road in Scotland.